صحة فطوركم. هذه حلقتنا الثالثة مع الدكتور كريستيان، جيرمان أستريان بود، متخصص في جراحة التجميل وفي مرض الليبيديما، موجود معنا اليوم. Welcome Dr. Christian. Ramadan Kareem. Thank you for joining us in our Ramadan episodes.
Thank you for invitation in this special episode.
Dr. Christian, can you tell us how to prepare the patient from the medical side, from your point of view?
Patients especially prepare themselves, so we doctors also prepare the cases. On the one hand, of course, the medical conditions, just like that are, everything is well done, and the laboratory parameters are well done, of course, for going under anesthesia, going under surgery, as well as we plan the surgery which stadium we have put the incisions, how much liposuction we will perform around about, not to risk any high levels of conditional problems with the patient, and that's why we plan in advance how we go to the surgery. This we also make during markings. We go through in our head how we perform the following surgery.
Yes, we noticed this, doctor, how you, while doing the first surgery, that you are taking in consideration where to stop and how to prepare for the second surgery.
Right. Maybe you have to go in several parts. If it's one surgery, two surgeries, more surgeries, yes. And this is how we make up a plan with the patient. Mm-hmm. And even one step or each surgery is planned just like in advance and go straight forward for the surgery, no to risk anything.
Yes, yeah. And each patient has an individual treatment plan, surgery plan.
Of course, each patient is individual. Each patient shows maybe different region. For one could be lower legs, for one could be both lower and upper legs. So it's very individual, each case. And we have to discuss, of course, in advance, which is the best, because not only we have different regions, maybe for a patient, one region is most important to treat first, because the suffering is caused by this special reason or region. And we have to admit, we have to discuss with the patient. There's the anamnesis, the first appointment with the patient, and there we schedule or plan with it.
So this means if the patient has a wish to start with a specific part, not as per your plan, it can be done.
Yes,
we can fulfill
sure.
These wishes.
Yeah, sure.
Okay.
We plan it together with the patient.
Okay.
Just like imagine if you have lipedema in the upper and lower legs, but the most suffering region would be the calf. So of course you start first then, and maybe it's also chance how much how much you can get out maybe in the upper part as well in one surgery, and starting while the lower leg, taking out everything, and still there's something left of volume you can take out of the lipedema from the upper legs as well.
One question which I face a lot while dealing with our patients, is there an age where you say this age is not a candidate, starting from this specific age, we should not do the surgery, or we advise to stop doing surgeries, or can we help specific
Of course,
patients?
you look for ages, especially very young patients and very old patients. Old patients, because maybe they're suffering of illnesses of the heart, of the kidney, you have to encounter, because we do general anesthesia, maybe.
Mm-hmm.
So you have to check the patient's history, of course. So could be a limitation, is not always, but could be.
Mm-hmm.
An option could be as well, just like to go for surgery under local anesthesia, but it's very individual. And as well, especially for younger patients, because it could be maybe the first surgery at all. And as we know, lipedema, it's a developing illness.
Yes.
Yeah, not could be clear maybe if you're very young. Yeah, and you just show not all but a few symptoms, of
Yes.
course. And then it's not just to go straight to surgery. Could be one option is to wait a little bit to see how it's developing.
So there is no age where we say, yeah, we should not. It's always the condition of the
Yeah.
patient, the medical history.
It's an
which is
individual case.
Yeah.
Yes, especially if you're very old, or it's an individual as well if you're very young.
Can we combine plastic surgery procedures along with the lipedema surgery?
Of course, the more fat you take out, sagginess of the skin could be a risk. That is not all just like reducing of the skin. So this redundant and leftover skin can cause problems as well, just like bruising, redness, maybe in between legs or arms, yeah, that cause inflammation of the skin. So of course we combine liposuction with maybe liftings. So it's a combination of liposuction and plastic surgery.
I mean, other procedures, yeah, like pure aesthetic, breast lifting. Mostly our patients, when they reach a specific volume, they undergo some other procedures, bariatric surgeries to reduce the weight. But unfortunately, the lipedema areas, they stay the same, but they will face the sagginess of the belly area or the breast or the face.
For example, by bariatric surgeries, you don't lose weight on your legs if you're a lipedema patient.
Yes.
But you have, of course, maybe redundant skin or leftover skin in the breast and the abdomen. Of course, you would combine abdominoplasty or a surgery for the breasts, maybe a lift, yes, or combine with an implant. The wish, just like the patients have, yeah. And we know in plastic surgery, if you change one part of your body, the attraction is on another part, of course. You look yourself in the mirror and you see one corrected area of your body, and you look or attract your view on another, maybe then bothering region after surgery, after the first surgery. So it's always just like in the plastic surgery, you have to also discuss with the patients ahead that this effect can come
the
after surgery.
expectations of the patients, yeah.
So of course you combine different regions of the body, not only abdominoplasty, maybe brachioplasties or mammoplasties.
The patients mostly ask us if they can get rid of the lipedema in one surgery from all the body parts. This is the biggest wish they have.
Yes, would be also for a doctor.
Okay.
To fulfill that. Yes, of course, because surgeries means risk.
Yes.
It's not the only risk of a surgery itself, maybe anesthesia risk as well, of course. And especially if patients are in a risky situation, maybe they have an illness of heart, you wish to do in one surgery.
To reduce the number of surgeries.
Yes. We are interested in reducing the number. But the thing that we face is, while taking out the fat, you change the circulation of the body. And then you get in a risky zone. And you don't want to push the patient into high risky zones for circulation problems. Okay, that's why we reduce or cut it down in different steps. We cut it down in different surgeries. If we do all in one surgery, but it's not possible maybe. Okay. When you take out more fat, you will have conditional problems of the heart, the pulse, the heart ratio, and things like that. And that's why we cut it down in different steps. But there is, of course, the option if you're a lower stage maybe, or you don't have too many different regions, lower legs, upper legs, plus the arms. If you're just lower legs suffering or bothering from lipedema, Of course, this can be done in one surgery. Or if you're younger or a lower stage, maybe stadium 1, and have clear symptoms, and maybe it's the legs and the arms, you can reduce that as well.
It can be combined in specific cases.
Yeah.
Another very common question, is it possible to use the fat and fill it in other body parts like the breast or the buttocks area? We have this question a lot.
Fat transfers are very common in plastic surgery, that's true. But we have to definitely distinguish between an illness fat condition, just like in lipedema. Genetics or your genes of the body, they change the natural behavior of your fat cells. They are ill fat cells, okay? They're more firm, they're more, even in the color is more gray and brownish than yellow. And they make the symptoms like swelling, bruising, heaviness, and all the symptoms patients suffer from. So I would clearly not recommend to do fat transfer in lipedema patients.
Okay.
You switch the problem from one region to the other.
Okay.
It can be safely done, of course, if you're a healthy patient, not suffering from lipedema. Of course, you can correct maybe asymmetrics of breasts or do volumizations in breasts or buttocks, especially by liposuctions, lipotransfers, but not in lipedema patients. Because you will, maybe the fat cells grow in there, and maybe safely grow in there, and maybe transform the problem to this region.
Okay, thank you for clarifying.
Yes. In lipedema patients, I would strongly not recommend that.
One more question, Dr.Christian, which we face as well a lot. Maybe it's related to our region here, to our nutrition. Many females suffer from having iron deficiency or having a low hemoglobin level in their bodies. We face this a lot. What do you recommend? How can they, but they need to do the lipedema surgery. So it's sad to not undergo it. How can they improve this level?
I don't see it's a very regional problem. It's a general problem. Just like women could have just like iron blood loss. So they have to substitute it with pills they take or infusions they take. And for preparation, maybe they can, of course, go for concentrate transfusions to prepare just before surgeries. But it's better to have a stable iron level because blood loss is a thing for surgery because it's a lot of bleeding maybe sometimes. The veins could lose a little bit while you liposuction, while you do or perform the liposuction, lead to a blood loss. So, of course, to make your conditions better, your laboratory tests better, check your iron blood and prepare for operation, even with a transfusion just ahead, maybe a surgery. You plan if you're very low in the iron blood or hemoglobin, and or take pills just like to prepare for surgery.
So once the plan is there, the intention to undergo the surgery, it's better to start.
Yes, in general, just like if the iron blood is low, the hemoglobin is low, and you even don't plan a surgery, you have to go to a general practitioner maybe to prescribe maybe just like ferrum you take as a pill. But if you're just like up to a surgery and we have this case right now for tomorrow, the blood or the hemoglobin is very low and you didn't recognize it in your whole life before, we can prepare for surgery.
Yeah. As we are in the holy month of Ramadan, do you advise to undergo the surgery before the month starts, then to heal during the month of Ramadan while fasting in terms of nutrition? Is it advisable?
I would go before Ramadan.
Okay.
because doing special diet while undergoing or ahead of planning a surgery would be, as a medical reason, not recommendable. So I would just plan ahead, and then you can heal afterwards very, very smoothly.
So the best plan is just before Ramadan to undergo the surgery.
Yes.
Then we have time to heal.
Yes.
During the month, use the opportunity to
during
have
the month,
a healthy nutrition.
Use your opportunity and not do special diet, because the condition of your body might be another one, just like if you don't go on a diet.
Thank you, Dr.Christian, for these valuable advices. Thank you for your time.
Thank you so much.
Thank you for being with us.
See you next time.
See you soon. شكراً على المتابعة. خلصت الحلقة اليوم مع الدكتور كريستيان وولف. نشوفكم المرة القادمة في حلقة جديدة مع ابنة الدكتور هيك، فرانسيسكا هيك، اللي كمان هي عملت ليبيديما سيرجريز وتحكي لنا عن تجربتها. شكراً، تصبحوا على خير.